Every day at the Oregon Insurance Division, we hear the same question. Why does health insurance cost so much? From small employers to families, Oregonians are frustrated with the ever-increasing costs. For a family, the average premium is nearly $13,000 a year. That's more than double from a decade ago. So why does health insurance cost so much? And what can the insurance division do about it? Let's first tackle cost. Imagine your health insurance premium was only $1. Your premium dollar must cover the cost of medical care plus the reasonable cost to run an insurance company. Medical care eats up most of the premium. In Oregon, about 89 cents of every premium dollar pays for hospitals, doctors, prescription drugs, and all the other care we rely on to keep us healthy. In just the past 5 years, hospital costs to have a baby went up 69%. A hip replacement? 51%. Even having your appendix out cost 53% more today than 5 years ago. And hospital costs are just one part of the equation. New drugs and technologies can drive up medical costs too. Many people without insurance rely on the emergency room, and hospitals and doctors shift the cost of those who can't pay to those who can. So, what about the remaining 11 cents of your premium dollar? Most of it, 10 cents, pays the cost of running the insurance company. That includes paying the employees who answer your calls, collect premiums, pay medical claims, run wellness programs, sell insurance, and more. Insurance companies also have typical office expenses and pay taxes and fees. What about CEO salaries? CEO salaries contribute less than a quarter of a penny to your premium dollar. The remaining penny of your premium dollar is spent on company profit. In 2010, Oregon's largest health insurance companies averaged a 3% profit. However, most of that profit came from investment income and not the price of insurance policies. So, add up 89 cents for healthcare, 10 cents for administration, and the 1 cent profit that didn't come from investments, and that's where your premium dollar went. Up to now, we have been talking about averages. But not everyone pays the same amount for insurance. You might be thinking, but my family is healthy. We rarely visit the doctor. Actually, your own family's health isn't a factor in how much you pay. You are part of an insurance pool. Remember, the point of insurance is to spread the costs of medical care across a large group of people so that those with serious health issues and high bills are protected. Even if you aren't using medical services, others are. Let's say you don't get insurance through a job, so you're on your own to buy a policy. Your price depends on the plan you choose, how many family members you cover, and your age. Where you live in Oregon can change costs too, since insurance companies negotiate different prices with hospitals and doctors from different regions around the state. If you're a small employer, the benefits you select, the average age of those you cover, and the amount you contribute toward the costs are all factors. And your group's medical costs may play a small part in your premium. How does the insurance division regulate all this? It is our job to make sure companies are financially sound and can pay medical claims. We make sure policies contain consumer protections and benefits required by law. We also regulate rates for the 12% of Oregonians who are the most vulnerable insurance buyers and lack the clout to negotiate rates. These are individuals and families that don't have job-based coverage and small employers. We make sure insurance policies are priced fairly, high enough so that insurance companies can pay medical claims, but low enough that they don't gouge consumers. It's a balancing act. Rates must also cover the reasonable cost of running an insurance company. But when we see out-of-line administrative costs, we cut them back. In some cases, we don't believe costs are justified. In other cases, we reduce or eliminate profit because of the impact on consumers. To give you a better idea of how the rate review process works, let's take the case of an insurance company that in 2011 filed a 22.1% rate increase request with the insurance division. That translated to an average monthly premium increase of $37. The company broke it down this way: $25 for the increase in the cost of care, $11 for new benefits required by federal health care reform, $1 for growth in administrative costs. As always, the division posted all the insurance companies' information online. Consumers had 30 days to comment, and hundreds of people did just that. We also received comments from a consumer advocacy group that reviews key rate requests. Finally, more than 150 people attended a public hearing on the rate request. After the 30-day comment period, our staff reviewed all the comments and looked at the company justifications for each part of its proposed rate increase. After its review, the division granted a 12.8% increase instead. We disagreed with the company's estimates of future medical claims. We also cut out any profit since the company's surplus is healthy. When we make our rate decision, we post an explanation online. If you sign up for email notification at www.oregonhealthrates.org, we'll email you when the 30-day comment period opens and again when a decision is made. So, Rate Review holds insurance companies accountable and wards off excessive rate increases. Unfortunately, health insurance still will not be affordable for a lot of people as long as medical costs are rising. But plenty of changes are around the corner. Over the next 4 years, significant state and federal reforms take effect, aimed at lowering costs and improving health. In 2014, for example, federal funds will expand the Oregon Health Plan for the poorest Oregonians. Federal tax credits will help many other families buy coverage. People will have more choices in buying insurance since no one can be turned down because of a pre-existing condition. Shopping for insurance will be easier in new online marketplaces. In the meantime, the insurance division will continue to scrutinize rate increases. To learn more about how the insurance division reviews rates, visit www.oregonhealthrates.org. The division's consumer advocates are available to answer questions about all types of insurance at 888-877-4894.